Hey guys, what's up? It's your girl Kaylee. You are tuned into Canton Backstage, and today we have Officer Todd Gillilan with us. He is actually the mental health liaison for the Canton Police Department, and we're here to learn a little bit about what he does behind the scenes. So thanks for joining us today. We really appreciate you being here.
Thanks for having me.
So actually, how did this program come about for the help with mental health services?
The origination of it, I'm not sure,
Okay.
but I know that they contacted me in reference to it. It went out and it came out in an email. I think there was a need for it
Okay.
in the police department, and so I.
You answered the call for it.
I did
You
answer the call for it.
That's great. So, as a mental health liaison, what are some of the things that you actually do with the program?
On a daily basis, we have forms. Let's start with the numerous calls we get
Okay.
of mental health crisis throughout the city. There are several calls throughout the day, throughout each shift, where we get calls from individuals in mental health crisis and from individual citizens that are observing
Okay.
individuals in mental health crisis. So they'll call our dispatch. Dispatch will put out the call to
Okay.
officers on the street, and we'll respond to it.
Okay. So actually, so when you go out, you're actually assessing the situation to see if someone needs help for mental health services when you go out.
That's correct.
Okay. So there's a form that you fill out, and I believe that's the crisis intervention form, correct?
It is.
Okay. So what is the crisis intervention? Because that's a training program also that the officers have gone through.
Their crisis intervention training
Yes.
is a training that a lot of the officers go through now. I'd say most of the officers that are getting hired
Okay.
are, almost all of them have to go through the crisis intervention training.
Okay. So what type of training is that?
It's basically mental health training that is conducted by mental health agencies.
Okay.
For officers to be able to recognize the different mental health issues, we're not doctors, so
Right.
we can't diagnose it.
Great.
But when you're handling a call, it's good to know and good to be able to say, hey, through my training and experience, I believe that this person has a mental health issue.
That's really huge. So when you're actually filling out the crisis intervention form, those are things that you can help those people with that you're going out.
Yes, the form, once our officers go and it's determined that an individual's in a mental health crisis, they will author and complete numerous forms, but the big one for the mental health intervention is a CIT form, crisis
Okay.
intervention form.
So what do you actually do with those forms? Like when someone is called and you go out, are you arresting someone right then, or are you assessing the situation more to see if they need actual help?
Once the individual, the officers respond and the situation's assessed, obviously it depends on the situation.
Okay.
But if it's determined that it's a mental health crisis without a crime being committed, then what we can do, we can activate mobile crisis.
Okay.
Mobile crisis will come out, which is mobile crisis is connected to the Coleman Center, and they're trained individuals that can come out and talk to the person in mental health crisis.
Okay.
Once that's determined, whether or not what we can do with that individual, what kind of help, what kind of options we have, once that call is completed, then a crisis intervention form is completed. And that'll list pretty much some triggers that the individual has, maybe what was done, the disposition, which hospital the individual went to. It'll give contact numbers for a family member.
That's really good. That's really good. So you actually keep track of all these forms, and so for
I
you
do.
as the mental health liaison, the form just doesn't disappear.
No.
What
it
what
does
do
not.
you do to help these individuals out in keeping track of these forms?
I basically compile every form that comes in. It's my call.
Okay.
So when I get a form, I'll come in the morning, check the forms, and while I'm seeing them, I know the mental health agencies are seeing them
Great.
as well.
Okay.
And then we have created what we call files for individuals. That way we can keep all the data for that individual through those crisis intervention forms together
Okay.
to
So
try and help that individual.
so when you're actually get a call for someone, maybe someone you have a form on already, you're actually taking that information and trying to piece it all together to
Correct.
help that person.
That's correct.
And you actually go a little bit further, I believe. There's some things that you do with the local courts where you can go
Yes.
in and help those individuals. Can you tell us a little bit about that?
Yeah, sure. Most recently, we have developed relationships. There's programs that exist in the courts for people that have committed minor crimes that we know have mental health issues.
Okay.
And a lot of times, while I'm conducting a background on that individual, there's a criteria to meet to get into that we can try and basically get them more help for the mental health
Gotcha.
and try and get rid of the criminal. So to keep them in the mental health program and keep them out of the criminal
Great.
aspect of it.
And that's something that we really need, because I think a lot of people, if you call the police on someone, some people are afraid to because they
Yes.
think they're just automatically going to get arrested. And so it's really great to know that we have you working that, because we do have mental health issues within Stark County, and the resources that we have available are really great if someone knows that they're available and can get the person that right help.
That's great.
So people can actually call into you if they need assistance, correct?
Yes, they can. They can call my direct line,
Okay,
which is 330-438-4432.
okay, and we'll put that up for them.
I'm not always in the office. I have a voicemail they can leave.
Okay.
If it's a crisis, if it's a mental health crisis, they can call the police department,
Okay,
say what crisis they're in. They can suggest a CIT officer respond, and that'll
great.
start things going.
So guys, remember that if you have someone that you believe needs help and this situation might not be safe, you can always call the police department and request a CIT officer to make sure that the person you're with is getting some help. So we have some great community resources available. Our officers are doing a great job of making sure that our streets are safe, but that our community stays safe and healthy as well. So we really, really appreciate that.
Well, thank you.
Thank you so much for being a part of this, guys. If you have questions or you need someone's help, go ahead and give Officer Gillilan a call, and we will put his number below. Can you give us that number one more time?
Yes, it's 330-438-4432.
Thanks so much for being here.
Thanks,
We appreciate
thanks
it.
for having me.